Walaikum salam.
How are you?
Good, good. How are you doing, Nayab?
I'm doing great. Welcome back to my show, Informal Conversations with Nayab Mufti Zuhir. And
Thank you.
thank you for giving us your time again and discussing a very, important topic that how America dealt with COVID-19 situation. So I believe
Right,
it's quite an
right,
interesting topic.
right. Basically, we were like, I am here in Chicago, and we were hit with this pandemic back in almost like middle of March. I remember it was like maybe 15th of March that we got the directive from our office that you guys can work from home. And this pandemic, we all became aware of it, and we started taking precautions. Um, but the surprising thing that this pandemic has actually revealed or laid bare some of the problems in the supply chain. I mean, there are so many aspects of that, but I will talk about some of those that I felt that were, quite obvious, or quite, you could, that's were very apparent, that that something that was very, sensible was not done. So, for example, when we were first, hit with this pandemic, it was very hard to find, the masks and these hand sanitizers, and these tissue rolls, and they just disappeared from entire market. So, and they were, even if you could find one, it was so expensive that you'd be surprised how expensive. How could they be so expensive? So, the first of all, like in terms of the readiness of America to deal with such a situation, they were totally, it was a big failure. They were not ready to deal with it at all. And now that we have, so that was the first thing, I think, in terms of how they started dealing with it. And then the second thing, I think, is was the lack of testing that was uh, very conspicuous by the absence of it. So they didn't have the resources, they were not ready for it, hospitals were not ready for it. And another thing that I felt very strongly about was, like, if this virus first appeared in China, and then there were reports of more cases in Korea and China, but they did a very good job at testing people and tracking people, and then isolating them to make sure that the spread is contained, uh, which which was not the case in America. I mean, at least I didn't come across anybody who was forced to isolate themselves. So I think it kind of relates with the type of society that America is. It's the personal freedom, and the idea of your choice is so deeply ingrained that sometimes it goes against the welfare of the entire society, but they stick with that. So I mean, I thought that, like, for example, this virus started back in Wuhan, China, right? And I saw videos of people saying that they were locked down in their own houses, and they had to, and the government took responsibility of delivering the essential items like the food and grocery and stuff like that. So which was not the case in America. So surprisingly, but then as we moved on, first started moving. We first started working from home, and then we didn't have enough direction from the CDC or from the National Institute of Health, as with regards to what precautions to take. It was after a while that they decided, oh, this mask seems to help. So and they made it mandatory for people to wear masks wherever they were going out. Whenever they were going out. which was also kind of surprising. It came very late to America. People in China and other parts of the world were already using masks and trying to contain the spread of the virus. So, and this is evident by the number of cases that you see. Like it's almost 6 million cases in America as of now, and almost like 180,000 people have died. So, which is a staggering number, of deaths. Um, and first, it started appearing in the northern states of America. Like New York was locked down at first, and it had a majority of the cases were in New York. Then California had some cases, and Chicago and Illinois. We had our peak back in, I believe it was mid of April or maybe early May, but then the cases went down, the number of cases went down. But I think it's as they started reopening, the cases are starting to go up as well. So and now and then the after the spring, the cases started appearing more. In a higher number of cases were reported in the southern states like Texas, Arizona, and Florida. So, which you would think that maybe the hot weather would help with the with the containment of the virus, but it seemed to have no impact at all on the way virus was spreading. So, and people, so the thing is, America, it's like any other society, maybe a little different than many other societies, many developed countries, many other developed countries. People here, there are people here who seem to believe in conspiracy theories, and they are very adamant in their opposition to any of these precautionary measures that government has suggested. So there have been reported cases where people have fought over with the customer care or with the store salesperson when they asked them to wear the mask, and they said no, we don't want to. It's our right not to wear a mask. So you cannot dictate us to wear a mask.
Really,
So
I
in
mean,
terms of
seriously,
yeah,
over here, like हम ये समझते हैं कि वहाँ पर लोग बहुत ज़्यादा rules and regulations को follow करते होंगे, and we always
right,
think कि नहीं पाकिस्तान में people are not following these rules, SOPs that government has
right,
made for people. और अगर देखिए, it just came as a surprise to me कि in America people actually were not following any SOPs.
right,
They were not
right.
even
So
wearing masks.
even like even now, if you there are states, there are cities, there are towns where if you I mean you don't have to wear a mask. It's not mandatory. People wear out of their choice, or like it depends. Also, America is such a diverse country. If you live in a like a big city like Chicago, New York, or somewhere in California, like LA or somewhere, maybe people are more cognizant of their duties or their responsibilities as a citizen. So, but you go into rural America and you find all types of people who they have their own way of looking at things. And the another thing is, the person that we have as president of the United States right now, he actually peddles those conspiracy theories. Like you might have heard about this hydroxychloroquine, as a treatment for COVID-19. I don't know if you follow American news or not, but it's very surprising that there is a liquid bleach here with the name Clorox, and he suggested that he later on he said that he was joking, but he said that if you drink it, you would be saved from COVID-19, and people actually drank it. Even yesterday there was like 50 cases of people drinking Clorox, thinking that this bleach
Oh,
will keep them away from the virus.
seriously, like he said that on media?
He said that on media, and
My
later on
God. And then he said he was kidding?
he was kidding. Yes.
On such a
So
serious matter.
and people actually followed on that advice. So all I'm trying to say is America, as any other country, is a very diverse country, and unfortunately, or if you look from my perspective, there may there are people who support Trump. So I don't want to say that it's my opinion that Trump's administration was not ready to deal with it, and he kept on saying, that okay, this virus will go away on its own. It's just a flu. But I mean, these were the sentences that stick out of that time, when this pandemic first hit. So it's very surprising that how could you have somebody as a president and then dismissing such a potent disease, such a dangerous disease. So it's very surprising and it's very unfortunate at the same time. If there were somebody who were sensible, who had some leadership, skills, they would have tried to contain this pandemic or this virus right from the beginning, because there are intelligence reports that this issue of this virus was reported to the president back in January, but he kept on saying, oh, this is just a flu, this is just a virus. So when later on it became like a pandemic, or the World Health Organization designated it as a pandemic, that was later in March. And then that's when we had the lockdowns. So in one respect, that's how I think they shouldn't have dealt the way they dealt with that. But on another good thing, I think that was that they did, which Congress, like the overall politicians and the government, they decided to give this CARES Act, which was the stimulus money to people who were laid off from their jobs, and some extra unemployment benefits to people who were who lost their jobs. So that was a good step, I think, on the in terms of maintaining people's livelihoods. So, but that also expired this late in July, and now there's talks of another stimulus bill, but it hasn't passed yet. And now we are, moving in, closer to the election time, and this is becoming a political issue now. But there will be, hopefully, there will be another round of stimulus bill. But luckily, I didn't lose my job. I was working from home, and that I didn't need that money, or I didn't take any of that. But it was good for people who lost their jobs. So on that front, at least, you could say that they took care of people who lost their jobs in terms of financially, they helped them. But I think in terms of this has been a surprising thing about this virus, that it has behaved, or the way it has spread is kind of mind-boggling, because some places you see it's spreading like a fire, and in other places, there are no cases, or there are cases, but they're very limited cases. So when I compare like the US with Pakistan, I feel like I know that there are, the thing is, this is another funny thing that President Trump said about the higher number of cases in the US, that since we are testing more people, that's why we have more cases. So, which is actually, I mean, whether you test or not, that's another thing. But of course, there are cases whether you test them or not. So the number is reflective of the actual situation. So it's not because of the testing that the number is higher. It's, so this is true for Pakistan also. I know people who in Pakistan who had the COVID-19, but they never tested for it. They never went to a doctor. They never, they took care of themselves. They isolated themselves at their homes, and they
Yes.
took care of themselves.
Yes.
So they got better with time. So
even now there are many cases, but people are
yeah.
thinking over here in Pakistan that coronavirus is not here anymore. right? So
Okay.
they are totally ignorant of it, and they are not wearing masks, and they are not taking any precautionary measures here in Pakistan. It's
Right.
really
Right.
a situation where I believe, I feel like people still think there was no coronavirus at first time. It was
Yeah,
all a
right. I
vax,
mean,
basically,
even
for them.
even even I've heard people saying that, if you go to a doctor, they're going to give you an injection that will kill you. They just want to show high numbers of cases, and
Yes,
that way they
exactly.
can get more donation, and
And other things, the
and
hospitals are also getting a lot of aid from government. That is why they are
right,
declaring more coronavirus cases, and they are also saying, okay, if
right,
it's a general flu, they call it coronavirus just to get aid from government. So a lot of conspiracies here.
right, right, right. So and I was like, I tried to reason with some people, why would you think that somebody would want to kill you, but it's easy to fall in the trap of the conspiracy theories, because they have been left on their own, so there is not enough awareness or direction from the government, that even the government in Pakistan also, initially Imran Khan said that, okay, this is just a virus, we have to keep our economy open, because if they don't die of the virus, they will die of hunger, so there are, so the thing is, I think these conspiracy theories find some people who believe in those, because there are people who are, who are, maybe they're downtrodden, or they don't have the luxury of staying at home and still making it, so I can feel, I feel empathetic towards them. So I don't blame them for that. If they, even if they believe in that, I say, okay, yeah, I mean, that makes, let them believe that, because at least, you help them, with in terms of trying to reason. But if they can do better by even believing in those conspiracy theories, I mean, they should take precautionary measures. There's no doubt about it, and that's, whenever I talk with somebody, I try
At
to
least
stress
for
on
others.
that.
Even if they
At
don't
least for
believe
others,
in
yeah.
it, they should take
Right,
precautionary measures for others. So like,
right,
so America and Pakistan, we are dealing with the same situation, right? With same
right,
sort
right,
of people.
right. The thing is, that's what I keep telling people. This I wouldn't want to be a reason for somebody's death. So I wear mask because I want myself not to be a reason for somebody else problems. So luckily we live in a condo building and apartment building. Everybody here follows the protocols, and they're very cognizant of their responsibilities. So I've not had much trouble in terms of my own personal experience, but at the same time, on a broader scale, I wish we had in America, they were prepared for such a situation. The thing is, with the globalization, even the masks were made in China. You know, so once this virus broke out, there were not enough masks to go around. So they actually suggested using cloths as a mask, and but even that direction came very later, very late in the pandemic. So there's been some confusion in terms of how the virus spreads. Earlier they said, okay, if you get close to somebody who has the virus, there's a chance you will get it. But then they did more research on it, and they said, no, if you just have an encounter with them, a fleeing encounter, that you just pass by them, it's not going to be a reason for you to get, the virus. And then, there was some controversy regarding that also, that people said, whether it's airborne or not, you heard about that, that it's the virus stays in the air or not. So there was
Even
some,
if you breathe in that air
yeah,
after 4 hours, so you will get the
right.
virus. Like a lot of confusion was
Confusion. There was a lot of confusion
a lot of
regarding that.
confusion. Yes.
So, and then, it depends on if you get the virus, how your body reacts to it. There are so
Your,
many things that
exactly,
can
your
go.
immunity, your immune
Your
system.
immunity,
A lot of
right,
people, they got infected, but they recovered at their own. So there
right,
are a lot of people like that. They quarantine
yeah,
themselves. the
And the
isolated.
majority of deaths in America, they happened almost like 50% of the deaths they happened in the nursing homes, the old where old people live. So I believe that has to that explains something at least, that because these nurses or people, the caretakers in the nursing homes, they go from one place to another place, and they maybe have carrying the virus with them, and transmitting it to other older people. But going forward, I just wish now they have started. They have everything is available. You have sanitizer, hand sanitizers.
Okay, and
You
what
have
about current situation? Like, is there
so.
still cases of virus, coronavirus there in America,
Oh
or
yeah, there are like
things?
about we hit another they say peak. We hit another peak sometime back later in early in August. We had like 60,000 cases each day. So this is again, this America is a huge country, and we have the majority of cases were happening were reported in Texas, Florida, and Arizona. But the wave seems to be subsiding now, but still there are cases like 30,000 cases or 40,000 cases like that every day. But it's spread out, like you have 5,000 cases in Florida, 4,000 cases in Texas, 10,000 cases in some other state. In Illinois, where I live, or the Chicago area where I live, Cook County, we have around 1,600 cases each day with a positive rate of about 3%. So this is another term that we came to get acquainted with this pandemic, that the rate of positive cases is important. So if you test like 100 people earlier, the positive rate was like 20% or something. So every 1% out of five was infected of the tested people. So you could um, interpolate from there, or get an idea from this number that okay, this many people have cases. So if we have not tested the entire population, you can get some idea from the tested population. So that rate has dropped down to 3% now. So every 100 people you test, there's like 3% people who have it. So it's going back up again. I hope it doesn't go back up again in winter, because we are nearing the end of summer now, and fall is about to start, mid of September, and then the weather will, it will be cold again. It will start getting cold again. But I don't know if the weather has an impact on it. So we will see. Hopefully, it would not be an issue. But you never know, right?
Okay,
So
so then no final sentences. What would you suggest people? Should they take care even now? Should they wear masks?
yeah, I think it's
You
very
know,
important that people, not for the sake. I mean, if you are sick and tired of your own life, at least take care of other people's lives. I can relate with that feeling. You're sick and tired of your own life, but at least take care of. You don't want to be a reason for other people's problems. So I
well
highly
said.
recommend
Well said.
people.
Thank you for the
Thank you,
time.
Nayab. Thank you,
It was a great discussion indeed.
thank you, thank you.
Take care.
You too. Take care. Bye.
Bye.